In this morning's Health Watch, as we head into the new year, probably like us, you're thinking about self-improvement. An estimated 79% of Americans who make New Year's resolutions focus on their health. Chief Medical Correspondent Dr. Jon LaPook joins us this morning with advice on how to make realistic and meaningful health goals for the new year. Dr. LaPook, look, Adriana and I, it's like we didn't have time to make our own appointments. We're here visiting you. We are patients. Give us an idea. I mean, people make these resolutions, but are they a good idea?
Yeah, I think they're a good idea if you set yourself up for success rather than failure. So you don't want to have something so nonspecific in general. I'm going to be a better human being. What does that mean in terms of your specific activity, right? But go small and give yourself goals that are achievable.
So what is small? Like, I want to exercise regularly, right? That was my resolution, which feels a little broad.
Right.
How small should I make it so that I can set myself up for great success?
So you can make that specific. For example, I'll tell my patients, you work on the 10th floor of a building. Take the elevator to the 5th floor and walk up 5 floors. Take the subway.
Okay, there's more, Adriana. Hold on.
Take it to the 9th
That's too specific, Dr. LaPook.
Or take a subway or a bus to, say, a few blocks from wherever you work or whatever you want it to be. Make it so that you're actually weaving it into your normal day. So it's not like, okay, now I got to go do exercise. It's part and parcel of your day.
Or could it be like 3 days a week you're going to exercise?
Right.
Yeah, it could be very specific, but try to do something that you can actually do. And when it comes to things like eating, right? That's something that people
always
want to have goals for. Think to yourself, well, like you know yourself well enough, when is it that you do that mindless eating where you say, why did I do that? For me, I'll walk into the kitchen at like 10 o'clock at night, I'll open the refrigerator door and look in. Am I hungry? No, I'm bored.
Yeah.
And so
what you looking for? What's your 10 p.m. snack?
Easier said than done.
Well, so I know that sometimes I just have to eat, right? Because so I'll have a bowl of carrots in water, that nice cold water, and celery. I know, a little boring, but just
that is so boring.
Yeah, but then if I know that I've already in my mind's eye gone. I just need to choose something, right? The other thing I do is,
that's what you do to make sure that you eat something healthy.
I eat something healthy.
It's a little
right.
hack. Okay.
And it's a hack, and also I'll say to myself sometimes like, look, kitchen's closed at 9:30.
That's what I said to my kids. Kitchen's closed, everybody.
It's closed.
Actually, no. My daughter pulls up a chair, opens the fridge.
No, it's not. Yeah. Is that the best way to get back on track? Because I think about the last few weeks, and most of us have just had irregular eating, drinking, sleeping, everything. How do you get back on track? Just little
I think
little
it's
moments
stuff
like
that you know, and you know that we've talked about it before. When you have alcohol, guess what it does? It disrupts your sleep.
Right.
Okay. When you're sitting there looking at those screens right before you go to bed, flipping through the Instagrams or whatever, it disrupts melatonin, gives you a tough time going to sleep. So sleep, I think that's a good thing to try to get going in the new year, and also just thinking about like, what am I going to do in terms of making my appointments, preventative medicine, and all that stuff.
What about getting our eating back on track? I mean, we all indulged. I was in Chicago with my in-laws. Grammy makes an incredible breakfast. She made Jamaican ackee and saltfish for us with dumplings. It's all fried and delicious. But like, I can't have that every day.
No, but like enjoy yourself, right? And you've heard me say, you're born, you live, and you die, and then that middle part, you do have to have some fun. So you know yourself, and you want to enjoy those moments. But let's talk about your granny, okay? Because I think
it's not my Grammy; it's my mother-in-law, who we call Grammy.
Oh, you're okay. Your mother-in-law, who we call Grammy.
Yes.
To be more specific.
Yes.
There's been so much social separation during the pandemic, and I think this is a good time for people to say, okay, I'm going to reach out to my loved ones, right? Social isolation increases dementia. So after this broadcast, don't do it right now, pick up the phone and call somebody you love, or especially somebody who may be sitting there alone. And another thing is, like, if you think of somebody, here's a good New Year's.
Call them.
You think somebody
Don't text, call them.
Give them a call.
Because you don't want to hear like, oh, I was thinking about you the other day and I was going to call you. You just do it.
And we're so quick to text, we don't always call.
Yes.
I know you told us earlier, I'm giving away a secret, you don't really do resolutions.
Yeah.
How about a wish for the new year? Do you have a wish for the new year?
I do have a wish that, obviously our healthcare system needs a lot of repair, but I think that, I'd love to see more preventive medicine. I'd love to see that technology. It's very exciting what's happening with technology. We talked about my colleague at NYU Langone, Bob Montgomery. He's pioneered this genetic engineering that allows you to take a pig kidney and put it into a human being, and it works. It's amazing. And speaking of genetic engineering, that kind of technology has helped people like Jonathan Lubin. And we told you his story just a year ago when the first gene therapies for sickle cell disease were approved. After a childhood spent in and out of hospitals, Johnny was one of the very first Americans to have his genes edited with CRISPR to stop his blood cells from sickling and causing intense pain. And we checked back in with the Lubin family, and I'm so happy to report the corrected genes are still doing their job. Johnny's now 16, he's playing basketball, he's learning how to drive, and he told us how great it feels now that he only has to worry about typical teenage problems.
We used to have a go bag ready in case we had to go to the hospital. That was always by the door with like my pajamas or whatever. But now we haven't had to do that.
And you know, when we spoke a year ago, you said that before the treatment, you were wondering if you would make it past 40.
Yeah. Before the treatment, my chances were kind of slim. I think now I appreciate the fact that I don't have to worry about that anymore, and I can just live life regularly.
He returned to New York Presbyterian Hospital to thank the team that cared for him. Across the country, these treatments have been slow to roll out. It's really tough to scale them up, but what amazing technology, and it really gives me hope for the years to come.
I hope they can scale them up.
Yes.
Sorry.
No, it is so transformational. You've done so much amazing reporting on sickle cell disease. Your 60 Minutes piece, I remember, it's crippling to someone, the pain that people go through. And now for this therapy to work, and you see a young boy can just be a young boy again.
Yeah, Janelle Stevenson was on the floor of an emergency room in agony, and the last shot of our 60-minute piece, she's running through the forest, and that was her dream, to just run.
Amazing.
That's science.
A little birdie told me that you actually may have made a resolution.
I did make a resolution, because, and I usually don't,
That's what
but
you said
only
to us,
because I was doing this piece. My resolution is not to start a conversation with my wife, Kate, when she's in a different room. That just leads to no good.
Not the like, hey.
Like what? What did you say?
What did you say?
I thought I told you, but yeah, you were in the other room, and like I didn't hear you, and so that's my resolution. Very specific.
Kate is all the better for it.
Yeah.
Did something happen recently that led to this resolution?
It happens often, and when you realize, oh my, of course you didn't hear me. You're like over there, and I'm over here.
We love Kate. We love the ties she gave you too as a gift.
Beautiful gift. And thank you for being here.
Happy New Year.
Year.
Happy New Year. Safe and happy and healthy New Year.
You too.